Hello, everyone, and welcome back to our 30-day English practice podcast. This is day 17, and today we're focusing on a topic that's both practical and essential, talking about health and basic medical vocabulary. Whether it's describing a headache, scheduling a doctor's appointment, or picking up medicine from the pharmacy, being able to express your health concerns in English is crucial, especially if you're traveling or living in an English-speaking environment. With me, as always, is my co-host, Alex. Hi, Alex.
Hi, Sam. Yes, health is a universal concern, and knowing how to discuss symptoms or handle a quick pharmacy visit in English can save you a lot of stress. We'll cover common phrases, key vocab, and basic dialogues so our listeners can feel prepared if they ever have a medical situation abroad or want to explain how they're feeling to English-speaking friends.
Part 1. Describing symptoms and common ailments. A. Basic health vocabulary. First, common symptoms: headache, stomachache, back pain, fever, cough, sore throat, runny nose, dizziness, fatigue, nausea. Example sentences: I have a headache. My throat hurts when I swallow. I'm feeling dizzy. Second, adjectives to describe pain: mild, sharp, constant, throbbing, burning. 3. Example: I have a mild headache, or this pain is sharp and sudden. Useful verbs, phrases: I feel weak, my nose is running, I keep coughing, I can't breathe well. B. Mini dialogue, describing a symptom. Hey Alex, you look pale. Are you feeling okay?
Actually, I have a terrible headache and my stomach feels upset.
Oh no. Do you think you caught something?
Maybe. I've been coughing a lot and my throat is sore.
You should get some rest or see a doctor if it gets worse.
Part 2. Making a doctor's appointment. A. Key phrases. 1. Introducing yourself and purpose. Hello, I'd like to make an appointment with Dr. Smith, please. I need to see a doctor about a persistent cough. Second, available time slots. Do you have any openings tomorrow? What time works best? Could I come in on Friday morning? 3. Confirming details. I'll see Dr. Smith at 10 a.m. on Monday, right? Do I need to bring anything, like insurance documents?
B. Mini dialogue, booking by phone. Good morning, Green Clinic. How can I help you?
Hi, I'd like to make an appointment with Dr. Green for a checkup.
Sure. Are you a new patient or existing?
Existing. I've seen Dr. Green once before.
Great. How is next Tuesday at 2 p.m.?
That's perfect, thank you.
No problem. Please arrive 10 minutes early to fill out forms. Part 3. Visiting the pharmacy. A. Explaining symptoms and asking for medication. 1. Basic vocabulary: painkillers, antibiotics, cough syrup, bandages, ointment, vitamins, allergy medicine. 2. Common phrases: I need something for a cold. Do you have any painkillers for headaches? How often should I take these pills? Is there a generic brand that's cheaper? B. Adverbs and frequency. Take 1 pill twice a day. Apply the cream once in the morning. Don't exceed 4 pills in 24 hours. C. Dialogue. Pharmacy interaction. Excuse me, I'm looking for something for a sore throat.
Certainly. Do you also have a cough or fever?
No fever, but I do have a mild cough. My throat feels scratchy.
I recommend this throat spray and some lozenges. Take them twice a day and drink plenty of water.
Great, thank you. Do you have any advice for preventing colds?
Wash your hands often, get enough sleep, and take vitamin C if needed. Part 4. Explaining issues to a doctor. A. Describing pain and duration. I've had a backache for 2 days. My headache started yesterday. I feel worse when I stand or after I eat. B. Talking about lifestyle or allergies. I usually exercise, but I haven't done so this week. I'm allergic to peanuts. I'm lactose intolerant. I have asthma.
C. Dialogue, doctor's office. Hi there, what brings you in today?
I've been feeling really tired lately, and I have a constant headache. It started about 3 days ago.
Any other symptoms? Fever, cough, nausea?
No fever, but my throat is slightly sore.
Do you have any known allergies?
I'm allergic to penicillin.
All right, let's check your temperature and blood pressure, and then we'll discuss the best treatment. Part 5. Medical advice and useful expressions. A. Suggestions and recommendations. 1. Rest and fluids. You should rest for a few days. Drink plenty of water or tea. 2. Take medication. Take 1 tablet before meals. Apply this cream at night. 3. Return. Visit. Come back if you don't feel better in 3 days. We'll do a follow-up next week. B. Responding to advice. All right, I'll do that. Thanks for the recommendation. Is there anything else I can do to speed up recovery? C. Over-the-counter versus prescription. OTC. Medicine you can buy without a prescription. Painkillers, cold medicine. Prescription. The doctor must authorize it. Some antibiotics or strong drugs require a doctor's note. Part 6. Practice Plan, Day 17 edition. To feel more confident discussing health. 1. Create symptom sentences. Write 5 sentences describing health issues. For example, I have a mild cough. My stomach hurts when I eat spicy food. Second, role play a doctor's visit. With a friend, practice a short dialogue. One is the patient, the other is the doctor. Focus on describing symptoms, giving basic advice, and discussing medication. Third, pharmacy interaction. If possible, simulate buying something for a cold or headache. Practice asking for recommendations and dosage instructions. Fourth, vocabulary review. Make flashcards or a small list of essential health terms. Cough, fever, prescription, allergic, etc. Test yourself daily. 5. Stay aware. If you watch movies or series in English, pay attention to scenes where characters talk about feeling sick or going to the hospital. Notice the expressions they use.
Yes, that's a solid plan. The more you rehearse these scenarios, the easier it becomes to handle real-life situations. Health can be stressful enough. Speaking English shouldn't add more stress. Part 7. Common mistakes and quick fixes. 1. I have a pain on my head. Fix. I have a pain in my head. Or simply, I have a headache. 2. My nose is running. As a question. Usually we say, I have a runny nose, or my nose is running. Statement form. 3. Forget to mention duration. I've been sick for 2 days, or I started feeling ill yesterday. This helps doctors or pharmacists advise properly. Pronunciation of certain terms. Stomachache. Stom-wach-ache. Ache. Achy. Pneumonia. Pneumonia. Mini dialogue. Clarifying mistakes.
I have a pain on my head.
You mean you have a headache?
Yes, sorry, I always mix that up. A headache is the correct term.
Exactly. Or you could say, there's a pain in my head, but I have a headache is simpler. Part 8. Conclusion and wrap-up. Talking about health in English can feel daunting, but learning the right vocabulary and common phrases makes a huge difference. Whether you're describing a simple headache or explaining long-term symptoms to a doctor, these expressions help you communicate your needs clearly.
That's it for Day 17. Healthy chat, talking about health and basic medical vocabulary. We hope you now feel more prepared to handle basic medical scenarios. If you found this useful, please subscribe or follow. And if you're on YouTube, leave a comment about your own health-related experiences or any new vocab you learned.
Yes, we'd love to hear about it. And if you have any questions about more advanced medical terms, feel free to ask. Though we're not actual doctors, we can help you with the English side of things. Tomorrow is day 18, so stay tuned for another essential English topic. Until then, stay healthy and confident in your communication.
Thanks for listening, everyone. Take care, and see you in the next episode.